Welcome to another installment of Gateway Today. I'm your host, David Cash Vasquez, and Gateway Today is that program that talks about all things Gateway Community Health Center, and today is no different as we head over to our pediatric department as we welcome some new faces and some familiar ones. First, we'll start off with Dr. Emanuel Martinez, a familiar face to the world of pediatrics here at Gateway Community Health Center, letting us know what to look out for this back-to-school season. Then we'll head over to Dr. Rachel Dal Fabbro, who will highlight some key aspects we should be looking for when talking about type 2 diabetes within our pediatric population. Then we head over to a brand new face, a new addition to the Gateway Community Health Center family, talking about our very own Dr. Beth Treviño, a Developmental Behavioral Pediatrician who highlights some key aspects she'll be looking for and helping our patients with as she explores her new journey with Gateway. Then we talk to Pediatric Neurologist Dr. Garza, who highlights some key data points that may surprise you when it comes to autism. We got a lot of show to get to, so sit back, relax. Another installment of Gateway Today starts now. Welcome to another installment of Gateway Today. Well, today we begin our journey in the world of pediatrics as we head over to Dr. Emanuel Martinez, a pediatrician here at Gateway Community Health Center, who reminds us about some important steps we should take for our little ones. Check it out. You know, you've really grown into a name that people recognize with, or is synonymous with pediatrics. And as a pediatrician, what is it that you have seen over that time in your practice, and how has it helped you evolve into the pediatrician you are today?
Well, you know, it's I just really love what I do. You know, the kids are really they bring me a great joy and happiness, you know, in my practice. And I've been very fortunate to have a lot of patients that have fortunately stuck with me, you know, throughout all these years. And I even have some patients that they're already having their own babies, and they grew out of my practice and now are having children of their own. So it's been very rewarding for me, you know, and medicine has been always something that I've always loved. Been at it, you know, since like 1989 as a practicing physician. So, but yeah, it's been good.
For the parents out there watching that or just have questions about when is a good time to visit the pediatrician? When is it a good time to get the kids in? You know, and as a parent myself, we often wonder those things. And you know, I'm glad that you're bringing up the vaccination effort. But what other things should parents look out for aside from vaccines and keeping their kids healthy? What should parents expect when they come visit Dr. Martinez?
Well, we're here to try, of course, you know, we don't want to just treat illness. We want to try to prevent illness. And so a large part of our practice is to make sure that they are well educated as to nutrition also, and all the things, safety concerns that may cause some problems with their children. So it's a whole myriad of things that we look into. But I think that most parents are very diligent with their children. They do bring them in on time, especially all the way from birth, all the way through their vaccination schedules and for their immunizations and their physicals also. You know, they do need their school physicals, and they're very important, and they're keeping up with it.
Well, you know, I'm glad that you're able to shed light on some of those key issues, because you're right. It would be a little weird if our parents didn't bring their kids in for their regular physicals, and so I'm glad you're bringing that up. And finally, you know, what's it like for you now that you've joined Gateway, and tell me about this experience that you've been seeing with Gateway. Is it almost like a breath of fresh air? And not just because you work for Gateway, right? But tell me about that experience as a physician, right? Like now you've teamed up with Gateway. How's everything going for you?
You know, everything is going just really well right now. The atmosphere in medicine has changed a lot, and we're having a lot of pressure being put on from different angles on physicians as far as paperwork, as far as just a lot of stipulations that they drop on us and all. And so we really need kind of a big brother to back us up and help us out with that. And for me, Gateway has given me that opportunity to be able to continue my practice the way I want to practice, because they're large organizations. They have a lot of help, for us physicians, and they're very open to all patients. I'm seeing all kinds of patients here in my office, and that brings a lot of warmth to my heart, and actually keeps me going too, because I'm not exactly 25 years old. And so I know a lot of people come in and say, when are you going to retire? And I say, well, you know what? I was on the brink, but now that I've joined Gateway, I've got a little shot of energy going, and hopefully that's going to continue.
Our thanks to Dr. Emanuel Martinez, a legend in the world of pediatrics. Our thanks to him for sharing those important tips when it comes to our little ones. That said, we're headed over to North Clinic with Dr. Rachel Dal Fabbro, another pediatrician here at Gateway Community Health Center, who shares some important information when it comes to type 2 diabetes within our pediatric population. Check it out. All right, ladies and gentlemen, we are here at our Shiloh North Clinic with our pediatrician, Dr. Rachel Dal Fabbro, to continue that conversation about pediatrics and specifically diabetes within our pediatric population. And Dr. Dal Fabbro, thank you for joining us on this episode of Gateway Today. I wanted to ask you about type 1 and type 2, and really to tell me the difference between the two within our pediatric population and how we know those differences.
Okay, so type 1 and type 2 diabetes are the most common in kids. Type 1 diabetes is pretty much an autoimmune process where you're gonna have the destruction of the beta cells of the pancreas, which are the cells that produce insulin. So pretty much your body is gonna destroy the capacity of producing insulin. So the treatment for that would be pretty much administering insulin, getting insulin from outside and putting back in your body. Now, type 2 diabetes, it's a combination of resistance to insulin and also the secretion of insulin is not appropriate. So you are gonna have insulin, is just not the right amount, and it's not, your body's not gonna respond to the insulin as well. So for type 2 diabetes, you don't necessarily need to give insulin. We can do other things to manage that type of diabetes. And then you're gonna see difference in the way that the patients are gonna present as well, right? So in type 1, because you're not gonna have insulin at all, those patients are usually younger and they're gonna present with more symptoms. So if you have no insulin, the symptoms that we usually see is increasing thirst, increasing urination. Kids might lose weight, they might be very hungry. We can have other symptoms like headaches, nausea, vomiting. So you see more symptoms in kids when they present with type 1. Not always, sometimes you're able to pick it up before, but usually kids with type 1, they're gonna have symptoms. Now, type 2, because it's a more gradual process of resistance to insulin, just to go back a little, resistance to insulin is gonna be caused by overeating, sedentary lifestyle, the resulting overweight and obesity. So it's a more gradual process. So those kids usually, they don't have any symptoms of the type 2 diabetes. And the way that we catch those kids, that we diagnose them, is by doing routine blood work and trying to identify risk factors to diagnose them.
And that's kind of what I wanted to talk about and let the audience know, which is the type 1 is inherent, right? Or something that
So there's a strong genetic, association. So we know that families where type 1, is prevalent, or kids that have other autoimmune problems, they have an increased chance to have type 1 diabetes. But also type 2, if you have a family that they say like, oh, diabetes runs in my family, a lot of times that's type 2. And you have a genetic component as well. So for both of them, you can have a genetic association, but not everybody that has a family with type 1 or type 2 is gonna, have diabetes. Type 1 is more like an autoimmune process, and type 2 is more related to your lifestyle plus genetics as well.
For the parents out there that are kind of wondering, how can I protect my child, or I have questions of my child has displaying symptoms of diabetes.
Yes.
What do you say to those parents?
Okay, so first, it's very important for parents to bring their kids for their physicals, right? So if your kid is doing okay, it's still important for you to take them to their yearly physicals for us to know if they have risk factors, we can screen them. And the way that we screen is by a physical exam. There are some signs of type 2, one that I forgot to mention, but it's like one that is important is what we call the acanthosis. It's the darkening of the back of the neck. Sometimes the armpits get a little darker. That might be a sign of insulin resistance. We can identify that in the physical exam. We are gonna check their weight, their height, see if it's appropriate. If we see any risk factors, we can check the blood to see if there is an elevated sugar there, right? So the key for us is to catch those kids before they're actually diabetic. So when the sugar is a little high, but not too high, so we can identify those kids and start interventions, right? So it's never, I don't like to talk about forbidden foods, it's more like foods that we can eat more and foods that we have to limit, right? So the junk food, fast food, cookies, chips, those should be in smaller amounts and fruits and veggies should be more, right? So this discussion is very important.
I think some parents are breathing a sigh of relief, right? Because everybody loves a little sweet every now, right?
Yes, every now and then, there's no problem.
For treatments, right? Medications, advancements when dealing with type 1 and type 2. What are you seeing out there through your research and through everything that you're seeing within the population? What are you excited about in terms of how we're going to be able here at Gateway to treat those patients?
Yeah, so, remember the type 1 and type 2, there are two different problems, right? So for type 1, the treatment, because you don't have insulin, the treatment is to give insulin. Nowadays, we have more modern ways to monitor both the glucose and the way that we're going to give insulin. So we have now monitors that we can put on the skin that can keep monitoring the insulin, the glucose. So kids not necessarily need to be poking their fingers all the time. So that's one thing that is more, advanced now. We have the insulin pumps. They're there for a while already, but they're getting more and more modern. So the insulin pumps are going to administer the insulin for you, so you don't necessarily need to inject yourself all the time. Now, for type 2 diabetes, the main thing first is to make sure that we exercise and control our weight, the diet and everything. But for kids that the diabetes is more, let's say, advanced and the sugars are higher, we are going to start medication, right? So if it's very, very high, those kids might need insulin, but most kids do not with type 2 diabetes. We do have medication by mouth. It's called metformin. It's a very common medication. It was the only one for many, many years that we could offer to our kids besides insulin. For the last 5 years, we have some new medications that have been approved for kids, medications that were used for the adult population for a long time. Now they're being approved in kids, the injectable ones, the ones that are famous for weight loss. For example, Victoza is a medication that it's now approved for kids. So we are very excited that this is another option, another layer of intervention that we can do for those kids.
And all available through our pharmacy, right?
Correct, yes.
Awesome, and that's great news for parents because again, Gateway is about all that 100% comprehensive care for your child, and our hats off to you for continuing to treat our pediatric population. Dr. Rachel Dal Fabbro, our pediatrician here at our North Clinic on Shiloh. Make sure you come and visit or start your journey at gatewaychc.com. Dr. Dal Fabbro, thank you for your time.
Thank you very much, David.
And thank you for watching another episode of Gateway Today. Our thanks to Dr. Rachel Dal Fabbro, an expert when it comes to type 2 diabetes within our pediatric populations. And if you have questions, make sure you visit gatewaychc.com to get those questions answered and get an appointment set up for your little one. That said, we're headed over to a new face, Dr. Beth Treviño, who has joined the crew here at Gateway after this break. More Gateway Today on the way. Don't move.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit. For your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Welcome back to Gateway Today. Well, before the break, we said we'd introduce you to a brand new face here at Gateway Community Health Center. She's a developmental behavioral pediatrician. It's a triple threat and a great thing for all of our pediatric patients right here at Gateway Community Health Center. Talking about Dr. Beth Treviño. Ladies and gentlemen, here she is. All right, ladies and gentlemen, well, we are here with our newest addition to the Gateway Community Health Center family, Dr. Beth Treviño, who is a developmental behavioral pediatrician. And it's a mouthful, right? But that's the reason why we have her on the program today. And really, Dr. Treviño, thanks for being here. Really want to just start with how you ended up here in our hands here at Gateway.
Absolutely. I'm from here. I'm from Laredo. I was raised here, went to school here. Actually, after college, I came back and I taught at Mary Help. I was the science teacher. So it all set me up for exactly what I do, which is developmental and behavioral pediatrics. So to do this in my hometown is kind of surreal. I was super excited that Gateway was ready to take this on, because there aren't very many developmental behavioral pediatricians in the country. So to have one in Laredo is really special. And for them to back it, because it's not easy financially to support that, but they were willing to take.
Well, I'm glad you mentioned that, because it's one of our efforts here at Gateway, which is to attract and not only that, but retain physicians here locally and bring the best of the best, right? And I'm glad you mentioned that your particular specialty is a very rare thing that we see, right? And to have it here in our community is major. So let's talk a little bit about that. Tell me a little bit about what a behavioral or developmental behavioral pediatrician,
What do you do?
What do you do, right?
And a whole lot of people, even physicians, don't understand what I do. My father was a physician here in Laredo for 45 years, and he used to tell his friends, like, he's a pediatrician for kids with special needs. Yeah. And that's about all he knew. He didn't understand why my office looked like a daycare. And why I didn't wear a white coat or a stethoscope, because I don't want to scare the kids. I want them to behave naturally and normally. Yeah. So they come in and they play with me, and I watch them play. And as I do that, I deduce where they are developmentally and whether that is on track or delayed or even advanced for their expectations.
So not a normal visit with the normal pediatrician, right? This is something that's more observational. Would you say that? It's something that you sort of have to see and then diagnose.
It's a subspecialty, so it's super complex. It's a combination of a comprehensive history, a physical exam that a pediatrician would do, with additional testing or assessment in developmental milestones or developmental skills like expressive language, receptive language, understanding what other people are saying, fine motor skills for handwriting, cognitive problem-solving skills, how they think, and all that's needed for learning and life and socialization later on.
And in talking about that, so for a parent that's watching right now, or any of our audience, your patient is what? What type of patient would you say that you're seeing, or that you're excited to see as you join Gateway?
So, developmental behavioral pediatricians typically see kids who are in the critical period of early brain development. Okay. So that time is from when they're born to about 6.5-ish years old. And we have that time when all of the little brain connections are being formed, right, and the little brain is kind of growing and changing. During that time, if we find any kind of delays and we start with the interventions, which aren't easy, like you can't go to the pharmacy and just pick up that intervention. These are all integrated into the community. Things like therapies and school services that require advocacy and information and how systems work, all of that. But we can, with the interventions, can actually fix those brain connections. And that delay can be gone forever. And this equals higher IQ points. All of these developmental domains that we follow are part of what creates a kid's IQ. So we're making these kids smarter for the future so that they're ready for college.
When a parent comes in and talks to you, like the vibe right now that you and I are having right now is it's exciting because I'm excited to see these patients get served. But when a parent comes in, what do you want them to expect when they come and visit you?
So it's not just a one and done and thank you very much, this is what you have, and go see your pediatrician. This is a lifelong chronic complex issue. So they'll typically be checking in with me every so often throughout that child's lifetime because life changes, that child is going to grow, and then their different issues will come up.
Right.
So little by little, we tackle the primary problems, and I help with the social and emotional well-being of the entire family, depending on what's the biggest problem at the time.
Yeah, so in other words, they're definitely going to get to know you for a very long time.
Yes,
Yeah.
yes. Yes, sometimes they don't like to leave.
Yeah. Well, and that's a good thing because I think that builds that relationship, right? Patient physician relationship that's strongly needed in our community, especially for kids that are faced with these challenges that are going to have to deal with it for the rest of their lives, along with the family, because it's not just one person, it's the entire family. And so, I can't say how excited we are here at Gateway to have you part of the team, and just happy to have you on the program to share some of your experience and some of your goals for our patients and how you're going to be able to serve them. So Dr. Treviño, thank you so much for being with us.
You're very welcome.
I appreciate it. Well, she is our newest addition, as I mentioned, to our team here at Gateway Community Health Center. She is our Developmental Behavioral Pediatrician that you can see right here at Gateway. Make sure you head over to gatewaychc.com. If you're not a patient, become one today. Dr. Beth Treviño, thank you.
Thank you.
Well, we're officially excited to welcome her to the team. Dr. Beth Treviño is a huge asset to the Gateway Community Health Center family. That said, we're headed over to our very own pediatric neurologist, Dr. Daniel Garza, who highlights some key data points when it comes to the world of autism. Check it out. All right, ladies and gentlemen, we are here with Laredo's only pediatric neurologist, Dr. Daniel Garza, who gave us some of his precious time to talk to us a little bit about autism. And Dr. Garza, thank you so much. I know when we were walking into your office, there's just so many folks looking for answers to autism. And I know some of our audience has those same questions that I do for you today. So thanks for your time. Tell me about autism and sort of what's happening in the world of autism right now. First of all, one of the numbers that kind of stuck out to me the most was that autism is more prevalent in men or boys than it is in girls.
4 times as prevalent. Yes.
4 times
it's 4
more.
to 1. For every girl with autism, there's 4 boys with autism.
And right now, kids are being born. About 1 in 50 kids is being born right now with autism. What is happening?
That's a very good question. And there's the long answer and there's the short answer. The short answer is we do not know. That's in short. We don't have definitive answers. As far as theories, there's many theories. In reality, sometimes we can identify what's behind what the root cause of the autism was, because autism is really a final common pathways of, we have seen some children with autism as a result or as a sequel of massive brain damage from meningitis, encephalitis, premature births. with internal bleeding, and they look identical to children with autism without those without that past medical history.
Yeah.
So, I mean, sometimes we feel that autism, it really has many causes, and it is like the final common pathway of many, many conditions.
What are those treatments that you find are most effective for patients with autism?
Well, the first thing we need to make clear is that autism is not a disease. So there is no cure because the kids are healthy. It's a developmental condition. And because of that, is one of the, frustrating aspects is that we don't have an easy answer. Here's the cure for your problem. This is an operation that will take care of it, or this is a medication that will take care of it, or I don't know, some genetic interventions. And now we have gene therapy for many conditions, but unfortunately not for autism yet, although that research is very exciting and it's ongoing. But we don't have a cure for this yet. We have treatments for what we call comorbidities, things that coexist with autism. A very large percentage of these children have a horrible time with sleep, and it's been determined that they do have issues with the release of their own melatonin. So melatonin is a fair, reasonable first and over-the-counter in this country option to treat the very frequent insomnia that these children experience, or fragmented sleep. They sleep. The problem is that their sleep is very fragmented. And for other comorbidities, some of these kids can be very hyperactive or aggressive, or they engage in self-injurious behavior. I mean, they literally bite themselves or slap themselves. So for those, we have, medicine for it. It doesn't cure the problem, it controls the problem, but they're reasonably effective and safe.
Well, Dr. Daniel Garza, he's Laredo's only pediatric neurologist. And Dr. Garza, I thank you for being a champion for the autistic community and for always trying to find that answer, because I see it in you. And when I hear you speak about it, I know you're looking for that answer for your patients. You have a ton of them waiting for you outside as we do this interview. And so thank you for giving us insight into the subject, and thank you for serving all of our patients here at Gateway. Again, if you need more information on Gateway Community Health Center, make sure you head over to gatewaychc.com or call us 956-795-8100 and make that phone call if you have questions about autism. Dr. Daniel Garza, thank you for your time, sir.
My pleasure.
Our thanks to Dr. Daniel Garza, a huge resource for those who are dealing with autism, epilepsy, and ADHD. And if you want to set up an appointment with Dr. Garza or any of our other pediatricians, make sure you head over to gatewaychc.com or call 956-795-8100 to set up your appointment or become a patient of Gateway Community Health Center. That said, if you want to catch a full rewind of this episode or any of our Gateway Today episodes, make sure you head over to YouTube and search Gateway Community Health Center, and don't forget to smash that subscribe button. As always, we thank you for watching this installment of Gateway Today, and remember, your health is your wealth, so take care of it.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100